Myself, Dr. Ashish Singhal, Senior Interventional Cardiologist from Lifecare Hospital, Rohtak. Today, I'll be talking about the latest update in hypertension. As per WHO, nearly 63% of the total deaths in India are due to non-communicable diseases, of which 27% are attributed to the cardiovascular disease, which affect 45% people in 40 to 69 year of age group. Raised blood pressure is among the most important risk factors for cardiovascular disease. Moreover, it remains poorly controlled due to the low awareness about hypertension, lack of appropriate care through primary care, and poor follow-up. In India, the prevalence has gone up above the over 30 years to 38% in men and 32% in women, from 29 and 28% respectively from the previous data. Despite that, nearly half of the people, around 50% of the men and 40% of the women with hypertension were unaware of the condition. Additionally, over 62% of the men and more than 53% of the women living with hypertension did not get treatment. Medication was used to control blood pressure in fewer than 1 in 5 men and 1 in 4 women, nearly 20 to 25%. With hypertension worldwide across the globe, International Society of Hypertension has released the data in their Global Hypertension 2020 practice guidelines. The inclusion of optimal and essential treatment paradigms attempts to address the issue that especially in the resource-poor settings. Optimal care refers to evidence-based standard of care, where essential standards refer to the minimum standards of care to allow specification of essential standards of care during low resource settings. The American Heart Association and American College of Cardiology has released a scientific statement in 2021 offering new guidelines for the management of stage 1 hypertension among patients with low atherosclerotic cardiovascular disease risk. Among low-risk adults, that is 10 years cardiovascular disease risk less than 10%, stage 1 hypertension, meaning their blood pressure ranging from 130 to 139 systolic and 80 to 89 diastolic. The management starts with non-pharmacological therapy. A recent study, which appears in the Journal of American College of Cardiology, reports that metoprolol can reduce lung inflammation and improve respiratory function in people with COVID-19 induced ARDS. Lowering systolic blood pressure targets down to the 110 to less than 130 millimeter mercury range substantially reduced cardiovascular adverse event in the STEP randomized trial, affirming the findings from SPRINT randomized trial from Chinese population of elderly age group. Among some 8,500 patients ranging their age from 60 to 80 years in China, the intensive target trimmed 26% of the composite CVDs. Findings from another second major trial supporting a lower target could unite the guidelines, which even among the US professional societies range from 130 to 150 millimeter mercury. With regard to prognostic value of ambulatory blood pressure monitoring and nighttime blood pressure, the 2018 European Guidelines on the Management of Arterial Hypertension recommends that the diagnosis of hypertension should not only be dependent on the office blood pressure measurements, but also on the out-of-office settings, particularly ambulatory blood pressure monitoring or home blood pressure monitoring. 24 hours and nighttime blood pressure measurements were associated with greater risk of mortality and a composite of CV outcome. Thus, they may be considered as the most relevant measurements for estimating cardiovascular risk. For every 20 to 10 milliliter increment of blood pressure measured at night, the risk of mortality increased by 23% and risk of cardiovascular events gone up by 36%. Most patients with hypertension require lifelong medical therapy to achieve optimal blood pressure control. The 2018 European Guidelines equally recommend 5 classes of antihypertensive drugs. Considering high non-adherence treatment, the importance of combination treatment is particularly highlighted to improve the adherence to therapy and blood pressure control. Therefore, the 2018 European Guidelines recommend, especially in the context of the lower blood pressure targets, to start antihypertensive therapy with an initial dual fixed dose combination of AC inhibitors or angiotensin receptor blocker in combination with either a calcium channel blocker or a diuretic. Since early July 2018, products containing valsartan have been recalled worldwide. The reason is the detection of a known carcinogen, namely N-nitrosodimethylamine, which is known as NDMA. which can be also found in candesartan, irbesartan, losartan, olmesartan, and valsartan. NDMA has been classified by the WHO International Agency for the Research on Cancer to be carcinogenic in humans. If more than 1 lakh of patients would have received NDMA contaminated valsartan from Xiang Huai Institute, where it is manufactured, every day for a period of 6 years, in the highest possible dose, it could result in 22 additional liver cancers over the lifetime. The presence of NDMA in these drugs could lead to 8 additional cancer cases in 1 lakh patients if they had taken the highest daily dose in over a period of 4 years. The valsartan recall, accompanied by a significant increase in the rate of emergency department visits by 6%. The next update is the HYGEA study, which represented the largest study that tested nighttime antihypertensive treatment. In this trial, the chronotherapy was associated with a significant reduction in endpoints, including death. The HYGEA chronotherapy trial tested whether nighttime therapy, in comparison to the usual upon awakening hypertension therapy, exerts a favorable cardiovascular risk reduction. This was the largest study conducted in more than 19,000 hypertensive patients. During an average follow-up of 6 years, 1,752 participants experienced the primary cardiovascular outcome. An ambulatory blood pressure measurement was performed for 48 hours to collect the data on how the blood pressure differed during the sleep. The relative risk reduction for CV events was significantly improved for nighttime treatment when compared with the awakening treatment. So that's all for latest updates in hypertension. Thank you.